Welcome to Saint Alphonsus Willcast, the podcast where we explore the many facets of health and well-being. This podcast is brought to you by Saint Alphonsus Corporate Health and Wellbeing and a generous grant from the Saint Alphonsus Foundation. Thanks for listening and enjoy the show.
Hello and welcome to the Saint Alphonsus Wellcast. This is Kim Kleveland. I'm the nurse practitioner with Saint Alphonsus in the Department of Corporate Health and Wellbeing. Today we are talking about all things related to the heart. We have Amber Kirtley-Perez with us. She is a physician assistant with Saint Alphonsus in Boise, Idaho with the Department of Cardiology. Originally from Haley, Idaho, she went to Boise State for her undergrad degree and PA school at the University of North Dakota. Now she works with St. Al's in the Department of Cardiology, and part of her position is running the preventive lifestyle clinic within the department, which is aimed toward reducing risk and preventing cardiovascular disease. Thank you so much for coming, Amber.
Thank you so much for having me today.
Yeah, it's going to be fun to have this conversation. It's one I've been looking forward to for a while.
Oh, good.
We have a little surprise at the end, which we're excited about. We also have Candi Zappia on with us, our community health educator, and she will be chiming in from time to time with her own questions and comments.
Yes, hello.
So, Amber, let's get to it. Can you give me an idea of how you got into the medical field and cardiology and what your interest is?
I got into the medical field after one of my cousins was an x-ray tech, and we chatted, and that's what I decided to go to school for. Then went on to nuclear medicine, and then really found that the heart was very interesting to me, and so went into the cardiac cath lab and then decided to go back to PA school. And then since I'd worked with the cardiology physicians for a long time, I was a natural fit to move over into that realm.
But they were super excited to bring you on.
I don't know. You can ask.
That's so great. Well, good. I'm so glad that you're enjoying your position there. And it sounds like you've kind of carved out a really interesting niche with doing cardiac disease prevention.
Yeah, it's been fun. The department has grown a ton, and we're really trying to work on decreasing risk. So it's been nice that I can push a lot of the patients who just have diabetes or hypertension or hyperlipidemia over to me to manage risk instead. And then the physicians are seeing more of just the heart disease and treating those patients and being able to do procedures. So it's been nice.
Yeah, it seems like the field has been, just from, perusing the medical journals and even popular magazines, it seems like the field is sort of advancing in terms of, you see all these new medications that are listed, or there's always seems to be an article about things you can do to reduce your cardiac risk, or touting this diet or that exercise program. And it seems like there's a lot of opinions, but then also a lot of new data in the field. Does that sound accurate?
It does. And the AHA, or the American Heart Association, American College of Cardiology, have done a great job in trying to keep up and doing lots of research. We are having new drugs in every single aspect of the field, between cholesterol or heart failure or even diabetes. And now we're really getting into anti-obesity medications as well, which is really neat to help start reducing risk.
Yeah, that's super interesting. What, in terms of the prevalence of cardiovascular disease, are you guys seeing in your field?
So you would think that with all these newfound fun medications that we have and people stopping smoking, so the amount of smokers have decreased a ton in the last 20, 25 years. But due to the increasing risk of, or increasing prevalence of diabetes, more hypertension, especially at younger age, childhood obesity, we're actually seeing a rise in cardiovascular disease. And it's still the number one killer in America of men, women, and of all ethnic varieties.
That's not as encouraging as we'd like to hear with some of the advancements. It feels like
that's kind of a bummer.
Yeah.
It is a bummer, but it's something that we can work on. And that's what I really am striving for, is that we can get out in the community more. This is the time that, gosh, maybe we should really start talking to high school kids.
Right.
And really working on what can we do nutrition-wise, and we're not invincible, and realizing that.
True.
Yeah, it seems to me, it sort of goes back to all that perceived risk, perceived benefit that we all know about as far as health educators. It's interesting because a lot of the decisions that people are making in terms of creating a lifestyle for themselves, particularly in younger ages, are impacting their heart long term, but their perceived risk as a 20 to 30-year-old who doesn't currently have any symptoms of cardiac disease is pretty low, right?
Yeah, it's, the prevalence now of non-alcoholic fatty liver disease, and they're seeing it in children. So the types of diet we're eating at home, we're not eating at home. We're not eating with our parents. We're not eating with our kids as a parent. We're eating in the car. We're eating on the way to a game. We really have to remind ourselves the things we can be doing at home to start decreasing the risk just with foods.
Right.
Is there any particular diet that you can recommend or that you see a lot of benefit for with patients in terms of preventing cardiac disease or metabolic syndrome and that? Or are there some basic principles you think may be helpful?
So the most studied diets, Mediterranean and now more plant-based, I try to really talk to patients about being more plant-forward. If we can get more fruits, vegetables, beans, whole grains into our daily diets, we tend to weigh less diabetes, better blood pressure, cholesterol goes down too. So those are the diets we talk about the most. I get a lot of questions about whether or not keto is, the best way to go. Or I had a gentleman the other day who was really into the carnivore diet, and that's only meat, literally nothing else. I didn't know much about it. So the ones that are more plant forward tend to be the best and have the most research. Unfortunately, nutrition studies are lacking. We don't do a lot of them. They don't make money there. So it's mostly what you can Google, but the most studied best are Mediterranean and more plant forward or plant-based.
Yeah, I was listening to an interesting, another podcast this morning, and they were kind of talking about reducing like highly processed, highly palatable foods. And I started looking even at myself or my kids, and I'm very health conscious. I consider myself health conscious, and I'm really health conscious with my kids. Like, you might find me in the pantry with like a Reese cup once in a while, but I'm hiding it from them. And as far as they're concerned, we eat, mostly really, really healthy foods. But then I was thinking more through it, and I was like, well, there still are a lot of like packaged things that I kind of let filter into our house. Like, occasionally that little pack of goldfish.
Yeah.
I'm like, oh, but they had their
Granola
vegetables.
bars.
Yeah, granola bars. Yeah.
Well, it's so easy.
It
It's
is.
so much easier when it comes to, especially when you're starting to pack their lunch, like to just have things that can grab and go.
But remember, it's the whole big picture.
Right.
So you can't be perfect all the time. But
Right.
if you can be 80% really trying, and then if you do want to give your kids a chicken nugget, don't get down on yourself for it. And them seeing you make, decisions with the peanut butter cup, or for me, it's a York peppermint patty. It's okay to do that. We just don't do it all the time. Like, we don't
Right.
keep ice cream in the house, but you bet that we'll go to the still and try
Yeah.
to enjoy the ice cream
Yeah.
on occasion.
Yeah.
So, because you want to teach that moderation to your kids too. Otherwise, they're going to think,
Right.
oh boy, like, we don't eat anything. It's just fruit and vegetables at home.
Yeah. I like how you're bringing in that intentionality to it too, because, I noticed like giving them that little cheese stick, or, that's not even a bad snack, but like, whatever palatable, highly processed food that I just throw them in the back seat on their way home. Like, I don't know that it really registers as food for them. And I think, thinking about myself too, that's another thing, like just, being sure that we're prioritizing those like meals together, or at least sitting down and eating, and that kind of thing seems like it's a good first step.
Oh,
Yeah.
100%. They even like, we've got one of my daughters, she's involved in gymnastics, and if we don't get to eat dinner with her, still when she comes home and one of us has picked her up, we sit, chat with her while she's eating, and we still get that family vibe and know that we've cooked a nice dinner. She's going to come home and still eat it. But we do, like, tonight we'll eat dinner at 4:00 so we can all eat as a family. And it's something that we just strive to do.
Yeah, I think that's
Right.
really, that's great. So eat more fruits and vegetables,
Please.
beans and whole grains.
Frozen too. Like, it doesn't have
Oh,
to be
yeah.
fresh. It doesn't have to be organic. And if anything, just please eat them.
Yeah.
Just eat them.
I like it. What other risk factors? So we kind of talked a little bit about diet, but what other risk factors are you seeing in terms of cardiac disease and, that metabolic syndrome and all of that?
So family history always plays a huge risk. And so that's always, you should talk to your family. I'm always surprised when people are like, I don't know, grandpa. So talk to your parents, talk to your grandparents. Knowing your numbers is huge. The sooner you know you have a problem, so say you have familial high cholesterol, the sooner you know that, oh, wow, my dad did too, and I got my numbers checked at 20, we can really have a good conversation. Blood pressure, that's another number I feel like is not paid attention to as much. Know what your blood pressure is. Know that anything over 120/80 or getting up and 130 over 85 is too high, and we need to really talk about managing it. Don't smoke, don't vape. Like, that's a big risk factor that we just try to eliminate. Not getting diabetes. So that's where, again, knowing your numbers, making sure your A1C is in a good range. And if you do start seeing it creep up, chat with a registered dietitian or your primary care provider and being like, so what can I do to lower my A1C, or even your fasting glucose? And then drugs, please just don't do them. And actually alcohol is also, you have to be mindful with that too. Knowing what the actual amounts are, and then also being aware that your IPAs are higher ABV, and we actually count those for 2 beverages, because when you're counting a beer, it's 5% of a 12 ounce. And if you're drinking like a 12 ounce, 8%, it's a little bit more than what you necessarily think.
Oh, those are all interesting points that I wouldn't have necessarily thought about.
Oh, when you ask about that glass of wine, you make sure it's the glass.
Measure it out.
It's a 5 ounce.
So when you are talking about knowing your numbers and checking them earlier, what age are you recommending that people start having their cholesterol checked periodically, or their blood pressure or whatnot?
In your 20s. That's like when we need to remind kids that, you've grown up, you no longer need a pediatrician, but you really should get a primary care doctor. I see a lot of patients who are in their late 30s, 40s, and even 50s who have not been to a primary care doctor, don't know that their blood pressure is high. And then we see them in an acute event, like they've had a heart attack or they've had a stroke, and they didn't know their blood pressure was 210 over 110.
Okay.
So in your 20s would be the best time. And then it's recommended, at least for cholesterol, to do it every 5 years, and just keeping an eye on it, because it does increase with age or change with your diet preference.
Yeah.
Right.
And people are always trying out new diets and things these days.
Yes, they are.
So, yeah, I think that's one thing that I remember from when I was working in primary care is, like, you'd see somebody and they'd come in for maybe a sinus infection, or their stomach was feeling unwell, and you'd notice they had a high blood pressure, and you'd say, like, oh, they're probably stressed because of X, Y, or Z. But I think, patients and people taking it upon themselves to note that number and then to have it rechecked in a month or two and just make sure that's not a trend, I think is probably important in terms of
incredibly important. And with the fact that there's so much salt in food. And the recommendation is 2,000 milligrams, and it's actually come out around 1,500 milligrams now with the American Heart Association, which is...
That's low.
It's low. And it's really hard
low.
to do. And so I'm recommending, I'm like, okay, your blood pressure's a little high. I want you to go home and I want you to read some labels. Write it down. Let's see where you're at.
Yeah.
And I'm surprised when I track it myself. I'm like, oh man, I'm 4,000 milligrams today. I'm like, that's a big deal. And I feel like I do okay. And so really paying attention, because if you can cut out some of the processed foods, the chips, the crackers and cheese, you start cutting that out a little bit, and people do see really big improvements with their blood pressure.
Right. And there's so many things to help you now. Like, instead of, writing stuff down, our phones, our apps, there's apps to track everything. You can just go to the grocery store. And I can't even remember what the app was, but it would give you like a green, yellow, or red for the food, like a grade.
I think that's Noom, the Noom app.
Okay. And it was just like, so you could just beep a food and it'll tell you. And then I would if you're in the cereal section, let's say, all the cereals are real high on carbs and everything and stuff like that. But it was like kind of fun to just click one and say, well, okay, well, this one's better, so I'll take this one.
Right.
Or, so there's lots of resources to help. If people get intimidated with like, oh, I've got to track everything, let your phone do it for you.
Yeah, I know. Use the technology for the good that it was intended. No, that's so great. So we talked a little bit about risk factors, the family history being a big one, and then the blood pressure and all those other things too. But let's say someone's healthy and has very few risk factors for heart disease. What are some of the major things someone in that position can do in order to prevent cardiovascular disease, like on a day-to-day basis? Like, what are some really simple habits you think you could incorporate?
Sleep. To be honest, the recommendation is now 7 hours.
Right.
Okay.
And that's uninterrupted. So yes, those of you who have young kids, that makes it a little bit more difficult, but good sleep, making sure you ask your spouse, do I snore? Oh, why is my mouth really dry? Is that my allergies, or am I like mouth breathing terribly? Because if you have untreated sleep apnea, that's a big risk factor too. So getting that addressed if you're not getting good rest. Another thing is exercise. We don't. And we need to be better. And all I want people to do is to go for a walk. And the recommendation is 150 minutes a week. And that's on the low end, but think that's like 30 minutes, 5 days a week of brisk walking. Or you can do, 10 minutes, 10 minutes, 10 minutes. You can split it up to however you want. But the more we can move as we become such a sedentary society, that can also help really decrease risk. And plus, how do you feel when you're exercising?
Right.
Yeah.
Because maybe you can prevent something from happening earlier by knowing how your body feels when you're pushing itself.
Oh, that's a really good point.
True. Yeah.
Yeah, I that's another thing. And I guess another point to bring up too would be that exercise, that brisk walk is outside of your activities of daily living, right? Because I do remember when I would ask people a lot, are you exercising or what are you doing for exercise? And they'd say like, oh, I walk up the stairs to brush my teeth or something. And just knowing that that's a very short period of time and it doesn't necessarily count toward that daily exercise goal, correct?
Well, and work doesn't either. So you'll have a construction worker, and they're like, well, I'm on my feet all day. Well, it's not getting that heart rate up to that brisk amount, which,
Right.
You can call it like zone 2 or whatever you want. But I just want you should be able to talk, not sing. And it's really pushing that for that 20 to 30 minute mark and keeping the heart rate up. And walking is easy, at least for most, making sure that people live in a safe neighborhood. Good sidewalks, have good balance. And so those are always good conversation time. Good footwear is another one. Please don't walk in your flip-flops. But just trying to get people to move and sleep. Those, I think, are the two cardiovascular risk factors that are not discussed enough. And because we know about blood pressure, we know about your cholesterol, we know about diabetes, but what can we do to prevent those? Sleep and walking, especially when you're young, when we're invincible, guys.
And what about stress?
Stress is a huge risk factor.
Yeah.
How do you modify it? So, you talk about it. Is it really worthwhile to be stressed? How's my job? How's my family life? Should I maybe meditate? Should I take some time to myself? Should I be walking to get time away to enjoy myself, enjoy my surroundings, de-stress, decompress? Really making sure that you're, how do I want to say, enjoying life. Because when you're super stressed, it does make your blood pressure go up. It makes us eat unwell. I know when I'm stressed, I'm like, where's my cookie? Where's my candy? Where's the Cheez-Its?
Yeah.
So just trying to moderate that and figure what's going to work for you, because it may not work for the next person, but really making sure you can manage it and how to manage it and using all the tools.
Right.
What do you do to manage stress, Candi?
Oh, man. Well, I like to go to the gym. And so I like that time mainly because I'm alone. My kids aren't there and I'm able to just kind of like zone out and be alone and listening to good music. Like if I'm in the kitchen, because I don't really like to cook that much.
Yeah.
But if I turn on my Alexa and I turn on like my favorite songs and things like that just, it changes my whole mood. I'm not, getting frustrated over, I still got to help the kids with their homework. I still need to get this done. I got to cook this, got laundry, all these things to do. And it just kind of like puts me in a good mood. So I think just finding the things that make you happy that aren't necessarily, food related, but like, but other things like moving your body, listening to good music, calling a friend that, doesn't stress you out.
Yeah, exactly.
Read a book.
Reading a book. Yes. Reading a book or listening to, a podcast or story, as long as it isn't like too true crime.
Yeah, exactly.
That gets my heart going. But.
Exactly. It doesn't count as zone 2 cardio.
Yeah.
No, I personally feel like I'm super type A. Like I'm always rushing from one thing to the next. I'm waking up. The minute I wake up, I'm rushing to get the kids ready, rushing to get myself ready, dropping them off, going to work, doing the stuff at work, rushing to this, this appointment. And inevitably someone spills the orange juice and there's, a mess somewhere that I feel like I have to clean up right now. And then I have to make dinner. And I don't know. I was listening to a friend tell me earlier in the week, she started using this technique with like a double inhale with a single exhale. So sort of like breathing in as deep as you can and then taking another little inhale and then breathing out through your mouth. And I've started trying a few times an hour when I'm in that like stressful zone, mostly like right before work and then after work, the push to bedtime, and trying to implement it a couple of times. And I've had my kids start doing it too. Like we all kind of take them in and we, you know, and it does kind of like recenter you, like, okay, this isn't an emergency, right? Because I think that cortisol and the the stress hormones being activated so much as that, you know, that day-to-day stress, even outside of,
well, and then you think stressors. Your lack of sleep, and then it's just a downhill.
Yeah, exactly.
Yes.
So yeah, I think for me, like that's been something helpful. I like your suggestions of sort of turning on good music and trying to make it a fun experience, whatever you're doing, and taking time for yourself and using that as the added benefit sounds really great too. Yeah. So tell us a little bit more about cholesterol and that LDL cholesterol and why we should care about it.
Well, that is what's going to build up the plaque in your heart arteries. So when someone comes in for like their yearly labs, you get a total cholesterol, you get your high density lipoprotein, so your HDL, which is the good cholesterol per se. You have triglycerides, and then you have your LDL, which is your low density lipoprotein, and that's your bad cholesterol. So it's important to know what that number is, because if it's greater than 100, the risk is a little bit higher in the lay person. And so that's something that we want to be like, oh, so what are the things that we can do before medicine? That's when we talk about saturated fat. We talk to a registered dietitian, be like, hey, we really need to work on decreasing the cheese in your diet. And we need to really work on increasing fiber, because that's something that we could do to help lower your cholesterol. Because say if I go in and my cholesterol's high, I'm not there yet for a medication.
Right.
But what can I do right now to help decrease that risk? And that's why the LDL is the most important one, because we know that's the one that builds up the plaque that's going to cause people to have a heart attack.
So you have high LDL cholesterol builds up these plaque deposits on your arteries, which then can clog the artery and cause the heart attack. And that's sort of like the definition of heart disease, right?
Yes, because they build up in the arteries over time, and then they can break off. And that's when we know there's a bigger problem.
And then, so just going back to some of the high cholesterol, high blood pressure discussion also, it seems like there have been some major advancements in treating cholesterol. Can you tell us a little bit about some of the new medications that are coming down the line?
Yeah, so we have our standards, your statin medicines, and those are our first line of defense, most studied drugs that we have. And
so it'll be like Lipitor,
Crestor, Pravastatin, those type of drugs. There's another drug that we use called Zetia that we use in conjunction with that. It only can lower LDL between 10 and 15%. So it's not the best drug, but it can help as an adjunctive drug. The two newer drugs that we have, the one is called a PCSK9 inhibitor, and it works in the liver to help block a protein, the PCSK9 protein. And then the newest drug that has come now is called Leqvio, and it actually works on the mRNA above the level of the PCSK9. And what's great about that is it's delivered twice a year, an injection twice a year, whereas our other PCSK9 inhibitors are twice a month, and statins are daily. So
can you just go back and explain to me what it was that you just said? The
PCSK9.
Okay, what is
which
that?
It's a protein in your body that helps make cholesterol, and LDL cholesterol is the bad one, and so it blocks it off, and it's like, oh, hey, we're not going to make you anymore. And it's really, really neat. And the fact that we can do and use these now is huge, because it's really helping with our patients who've got familial high cholesterol, because their numbers are pretty extreme. And so you can see reductions from 300 to into the 30s and 40s with these drugs. So it's really, we have huge advancements. But again, the biggest thing is cost. And just like all of these fun new medications that we have, cost tends to be the most prohibitive. So we go back to our standards. But we do have tools, and eventually it will get cheaper, and we'll be able to treat more.
Good.
Okay. So in terms of these medications and who might be eligible for them, like who are you putting on these like newer medications or even these statin medications that we've had for a long time?
So statins, number one, if you've had a heart attack, that's what you get. And we can trial lots. The goal, if someone has a heart attack, your LDL is less than 70. Your goal LDL, if you have diabetes and had a heart attack, is 55. So the lower, the better. But if we have a risk calculator, the ASCVD risk calculator, and it's great. So you can put your age, you can put your ethnic background, blood pressure, your cholesterol numbers, and it kind of pops out. You have a moderate risk, a low risk, a high risk. And so usually if you're under the age of 40 and you don't have any other risk factors, but your cholesterol is high, but you don't have high blood pressure or diabetes, we really work on diet. You're not going to be eligible yet for a medication. If you have hypertension, put you a little bit higher risk. We talk about maybe we should add in a statin. If you have diabetes, it's a recommendation no matter what to be on a statin medication. If someone comes in and their LDL is greater than 190, that's most likely familial high cholesterol. And we talk about a statin medication regardless of age, and to really reduce risk, because you can be building up plaque starting, in your younger years. And the older you are, the more risk you have. And we want to make it so you don't have a heart attack, at least in your 40s.
That makes sense. So truly lowering that LDL cholesterol is going to be a paramount portion of decreasing your overall cardiac risk, whether or not you have known cardiovascular disease. So we have this really interesting, exciting pilot that we are launching, which we're super excited to have you involved with. So let's talk a little bit about that. So it's this LDL pilot program, which we are running within our Saint Alphonsus colleagues currently, and maybe expanding depending on how things go. But it's an 8-week program that we're using to lower LDL cholesterols in otherwise healthy individuals. So it's for otherwise healthy adults without a known history of heart disease in themselves. And so we'll be incorporating some interactive educational activities, along with some individualized health coaching to help participants incorporate what they're learning into their everyday life and make it sort of adaptable to them. And then afterward, we're excited to offer a consultation with you to sort of further lower risk. So what could somebody expect from that visit or from the interaction with you in terms of, what are you guys going to talk about and what are the goals going to be with your interactions?
Yeah. So if you've gotten to me, well, we know that the number is a little bit higher than what we want it to be. So we talk about a lot. It's going to be family history, because I want to know, mom, dad, siblings, what happened to them? Are they still alive? And if they did have a heart attack or have had stents placed or bypass surgery, what age were they? So men under the age of 55, women under the age of 65 is an increased risk. Also, we talk about medications. Do you want them? Do you don't? How can I get you to try it if that's what we're going for? A lot of times we'll order a coronary artery calcium score, which is going to go and look at the calcium in your heart, in your arteries, and it gives us a number. And then it gives you a risk based on age. And so it can be 0 to 100, 100 to 400, 400 or greater. And it talks about risk. And sometimes that can push someone who's been hesitant to trial medication to go on a medication.
So it can kind of show the results of that ongoing high LDL cholesterol.
Yeah. And sometimes not everyone's like, I want to take a medicine. And so you show them the data, you show them what's inside them, and they're like, okay. But even if it's 0, that, we have another discussion if you can still have soft plaque versus hard plaque. And the big thing that I will work on is all the other individual risk factors too.
Okay.
So it's figuring out where we should go now with just your cholesterol, and let's manage every other risk. Like, do we need to do a sleep study? How is that blood pressure? Let's talk about the salt. And it's a whole team effort. But for me, it's going to be really working on what can I do to really decrease that with what's going on inside.
So it sounds like you're looking at the whole person and engaging all of their different risk factors, since we know it's not just ever one individual thing that causes the cascade of events.
I wish it was just one, because it'd be easy to modify that.
So what I've gathered from this conversation is to prevent cardiovascular disease, eat more vegetables, fruits, whole grains, beans. Your family history is going to be a huge risk factor for you going forward. So talking to your family and finding out what's gone on with grandma, grandpa, mom, dad, and siblings in terms of heart health is an important piece of the puzzle. Lowering your blood pressure, or at least having an awareness of your blood pressure and cholesterol numbers, and working with your primary care provider or other specialists to determine your long-term risk with that. avoiding excessive salt, avoiding highly palatable processed foods. All this is so fun. And then aiming for that 150 minutes a week of exercise that you can talk during but not sing.
Yeah. Oh, don't forget the sleep.
Sleep and the stress.
Let's get some sleep.
Increase your sleep, reduce your stress. And
I know it sounds overwhelming, but if you take each piece one at a time and work through it, it really is a manageable process. And the food doesn't have to be boring.
Right.
It doesn't have to be boring. Don't scare them away.
No, not at all. I think this is great because I like that. It doesn't have to be anything super fancy. It sounds like a lot of really doable actions in order to make some big results for your health, which is what we're all about here, right? So that sounds great.
Absolutely.
Oh, great. Well, thank you so much for coming on, Amber.
Thank you
it was
for
really
having
fun
me.
talking to you, and we look forward to working with you in the future on our great pilot program where we're starting next month. And we look forward to having you on again. So
Awesome.
Thank you.
Thanks, ladies.
Thank you.
Okay.
Thank you for listening to this episode of Saint Alphonsus Wellcast, brought to you by Saint Alphonsus Corporate Health and Wellbeing and the Saint Alphonsus Foundation. Always be sure to catch new episodes by subscribing to us through all major podcast platforms, including Apple, Google, and Spotify. We hope you'll tune in again. Until then, be well.